There are some very eye-opening statistics from the National Eating Disorders Association. 9% of the U.S. population, which is more than 28 million Americans, will have an eating disorder in their lifetime. One person dies every 52 minutes as a direct consequence of an eating disorder, and 22% of children and adolescents worldwide showed disordered eating. So here with us to discuss is Lindsay Soucy, the clinical director of Sweetzer's New England Eating Disorders Program. Thanks so much for joining us again. These are really important topics. So what are some of the signs of someone with a potential eating disorder?
Yeah, so there are many. A few that we see often are things like really rapid and intense weight changes, either direction. A sudden decrease in eating could include things like saying, I'm not hungry, or I already ate something, but in a pattern, seeing that happening over time. Noticing food missing, noticing wrappers or food hidden in the house. Frequent use of the bathroom after eating or shortly after eating. Sometimes we might also see really intense increases in activity or exercise that kind of overtakes one's life. That's their major focus. And then other things like isolation, withdrawn, behavior. And then there's also, of course, plenty of medical symptoms. So if someone notices changes or concerns with blood pressure or heart rate, those are a few of the things that we would be paying attention for.
So as family and friends, what can people do to support people or spot the signs of someone who might have disordered eating?
So certainly to pay attention to some of those things that I mentioned, and also to talk about it. So the biggest thing we remind patients and supports that come into our program is that eating disorders really thrive in secrecy. So making sure that we're having those conversations, though they might be uncomfortable, and not letting that remain secret is really important. And then reaching out to professionals for help. That might be a PCP, a therapist, and certainly our program is a resource.
And so some of the other signs that we look for, you were talking about some of the indicators, and that they thrive in silence. So how do you say it? Do you just come out and say it? How do you bring it up?
Yeah, it's a great question. So oftentimes we suggest things like asking direct questions. So I'm really worried about you. I'm noticing these things and I'm really concerned. And this is the reason why. I'm worried about your health. I'm worried about your safety. I've been noticing you've been much more withdrawn or not doing the things that you used to love to do. So expressing it from a place of concern can be really valuable, because that might be more inviting for the conversation to happen as opposed to telling someone something is wrong. So that tends to be a way that we recommend kind of getting that started.